Yes, Governor, thank you very much. So you mentioned that orders coming from Boise. I hate to keep going back to this, but you said orders keep coming from Boise, or that do come from Boise, don't go over well across the rest of the state. We've already talked about the protests. We've already talked about what's happening, but I mean, even places in Rexburg, Eastern Idaho, Moscow, Coeur d'Alene, anytime a health district tries to get together or a council tries to get together to implement any sort of compliance, they're facing all sorts of adversity. You just heard Dr. Scoggin say they're bringing patients down to Boise. So we're all in this together. You have the authority, as you mentioned, to kind of take a statewide approach to this. Why not take this heat yourself instead of having people feel threatened in their own homes?
If the decision point for me was I take the heat rather than the rest of them, I would do it. The decision point for me is how do I get compliance? That's the critical tipping point for me, is how do I get compliance? If the people in some of those communities won't do what their neighbors tell them to do, you made the point. What do you think is going to happen if that order comes from Boise, Idaho?